Hi, everyone. Thank you for taking the time to listen and learn more about diabetes. My name is Annika, and I'll be presenting on this topic along with my classmates Kendrick, Andrea, Shashira, and Ashlyn. We are second-year medical students in the Community Engagement Elective at Wayne State School of Medicine. And for this, we partnered with the Detroit Area Agency on Aging to create this presentation in order to spread awareness about diabetes. Just to start off, we want to give you an opportunity to gauge how well you know type 2 diabetes. So the first question I'm going to ask is if type 2 diabetes is preventable. So take a second to think, and then I will reveal the answer. So the answer is yes, type 2 diabetes is preventable. There's a reversible pre-diabetes stage that we will talk about more later in the presentation. Next question, is it common to have diabetes and not be diagnosed? So the answer to this one is also yes. It's actually an estimated over 7 million people in the United States that have an undiagnosed diabetes. And so now knowing that millions of people have undiagnosed diabetes, take a second to think about what actual percentage of the US population has diabetes. And so for the latest report, the estimate was that 10.5% of the United States population has diabetes, so it's very prevalent. Another question about the population with diabetes, which age group has the highest incidence or the highest amount of new diagnoses of diabetes? And for this, it turns out that adults ages 45 to 64 have the highest incidence, with adults ages 65 and up following closely. So next up, I have two quick true and false questions. The first statement is that an estimated 89% of US adults with diagnosed diabetes are overweight or have obesity. Is that true or is that false? So that one is true. That's about 28% were categorized as overweight, and the remaining 61% were categorized as having obesity or extreme obesity. And then my last question, true or false, the estimated direct and indirect costs of diagnosed diabetes in the United States was $150 billion. And this one is false. The estimated cost was much higher, it's actually $327 billion. So the overall high prevalence and the high costs of this disease make it a disease that calls for spreading awareness, which is what we're going to do here today. I hope starting off with those questions allowed you to gauge where you are with your understanding of diabetes. For the rest of the presentation today, we will be going through an overview of diabetes, how to prevent progression of pre-diabetes to diabetes, talking about eye disease and diabetes, depression and diabetes, and lastly, how to reduce hyperglycemic risk. So first starting off with a quick overview. Diabetes is a disease that comes from a deficiency or resistance to a hormone called insulin. So this insulin is made in our pancreas, and without proper functioning of the insulin, the sugar or glucose that's present from the foods that we eat can't properly enter the cells in the body. So this is what leads to the high blood glucose, because the glucose isn't getting into our cells, so it's remaining in the blood. So that high blood glucose is the measurement used to diagnose diabetes. You may have heard of the different types of diabetes. So just a quick overview, type 1 diabetes is found in younger ages. It's an autoimmune disease in which the cells that produce insulin get destroyed, and this type is not preventable. And then there's type 2 diabetes, which has a higher prevalence, and this is going to be the type that we're talking about today. It's the preventable type, and in this type, the body still produces some insulin, but the cells do not respond effectively.
So I will be discussing preventing progression from prediabetes. So individuals with prediabetes have elevated blood glucose levels. However, they have not reached the level consistent with a diabetes diagnosis yet. 1 in 3 American adults are pre-diabetic. However, only 1 in 5 adults are aware they fall in the pre-diabetic range. This is super important because prediabetes is reversible, as Annika mentioned earlier. So if you can catch it in the stage, you can stop it from progressing to diabetes. We are now going to do a pre-diabetes risk assessment test. Please make sure you have a pen and paper or anything to make notes on. This is a risk assessment test by the CDC. It will not tell you whether you have prediabetes or not. However, it will tell you if you're at greater risk of having or developing prediabetes, in which case you should follow up with your doctor. So question number 1, how old are you? If you're between ages 40 and 49, give yourself 1 point. If you're between ages 50 and 59, give yourself 2 points. If you're 60 years or older, give yourself 3 points. Right. Question number 2, are you a man or a woman? If you are a female, give yourself 0 points. If you are a male, give yourself 1 point. If you are a woman, have you ever been diagnosed with gestational diabetes? If the answer is no, or you're male, give yourself 0 points. If your answer is yes, give yourself 1 point. Question number 4, do you have a mother, father, or sibling with diabetes? If your answer is no, give yourself 0 points. If your answer is yes, give yourself 1 point. Question number 5, have you ever been diagnosed with high blood pressure? If your answer is no, give yourself 0 points. If your answer is yes, give yourself 1 point. Question number 6, are you physically active? If your answer is yes, give yourself 0 points. If your answer is no, give yourself 1 point. Question number 7, what is your weight category? Please take a look at the chart on the right. First, find your height in the left column, and then look right until you find your weight category. Follow this column down to determine how many points to add to your score. So if you haven't been adding up your points already, add them up now. If you received a score of 5 or greater, this indicates an increased risk of having prediabetes and developing diabetes in the future. In this case, please talk to your doctor for further testing. This does not mean you have prediabetes, it's simply an increased risk. How can I reduce my risk of diabetes? The number 1 thing is lifestyle modification. This includes regular physical activity, eating healthy, and weight loss, as obesity is the leading risk factor for diabetes. If you are a smoker, smoking cessation is very important, and the CDC offers lifestyle change programs for individuals with prediabetes. This is a 1-year program that provides CDC approved curriculum, a lifestyle coach, and a support group.
Okay, so now we'd like to talk about eye disease and diabetes. So what is diabetic eye disease? It's a group of eye problems that affect diabetics, and it can result in poor vision or blindness. It includes 4 different diseases, including diabetic retinopathy, diabetic macular edema, cataracts, and glaucoma. And we'll be talking about all 4 of these in a minute and showing you what they would look like. So how does diabetes affect my eyes? Uncontrolled diabetes is characterized by high blood sugar levels, as we discussed earlier, and high blood sugar levels damage the blood vessels in your eye, which causes them to swell. These blood vessels can then leak and increase pressure that pushes on the other blood vessels and the optic nerve in your eye, ultimately resulting in vision loss. So what is diabetic retinopathy? So this is one of the diseases that can be that you can have if you have diabetes with your eyes. So the retina is the inner layer at the back of the eye. You can see this in the image on the right. So this is the layer that senses light, and it sends signals to the brain via the optic nerve to produce an image. There are 2 types of diabetic retinopathy. The first is the early phase, which is non-proliferative, and it results from the blood vessels leaking and also can be managed through blood sugar control. If you don't end up controlling your blood sugar levels, you can progress onto the proliferative level stage. And this is where the blood vessels will leak, decreasing the amount of oxygen delivered to the eye, and this will promote new blood vessel formation and also you'll result in vision loss when the new blood vessels form. So this is what diabetic retinopathy would look like. So on the left, you have normal vision, and on the right, you have diabetic retinopathy, where you'll see parts of your image for your eyes will have nothing presented. This is where the different parts of your eye have been damaged without oxygen. You can also develop diabetic macular edema. The macula is the part of the eye that's responsible for reading, driving, and seeing phases. Diabetes is associated with macular swelling, and because of this, sharp vision will decline over time with this swelling, and also vision loss or blindness can occur. And this is typically a late complication of diabetic retinopathy. So this is what diabetic macular edema would look like if you were to develop it. So there's just spots where it's blurry and spots where you can't see. So cataracts are another disease that you can develop as a result of diabetes. They involve clouding of the eye lens, and this is because high sugar levels are building up in the lens. It tends to happen as we age, but diabetics tend to develop cataracts at an earlier age, and it's associated with cloudy vision and faded colors. So this is what cataracts would look like. You just would see a blurry image. And then also you can develop glaucoma from diabetes as well. It's associated with increased eye pressure. Increased eye pressure will push on your optic nerve, which is the nerve that relays image information to the brain, and it results in peripheral vision loss if untreated. So this can also be treated through medications or surgery that lower inner eye pressure, and this is what glaucoma would look like. So you can still see the center of your image, but if you look to the sides, your peripheral vision will be lost. So how can you decrease your risk of developing eye disease? So all diabetics are at risk of developing eye disease. Diabetic retinopathy, so 1 in 3 diabetics older than 40 may show signs of this, and glaucoma and cataracts are increased to twice that of someone without diabetes. Greatest risk with untreated includes high blood sugar levels and high blood pressure, so you want to make sure you control your blood sugar levels and your high blood pressure as well, and you can do this by talking to your doctor to see the best course of action. There's also an increased risk with high cholesterol levels and tobacco use. So if you could stop smoking, if you do, that will also decrease your risk. And then also eye disease risk increases the longer you have diabetes. What are signs of eye disease? So early symptoms are often absent, especially if you were to develop diabetic retinopathy. And if symptoms do occur, these would include blurry or wavy vision, frequently changing vision, which can change from day-to-day basis, and also dark areas of vision loss. Poor color vision, spots or dark strings called floaters, and flashes of light. You should see a doctor right away if you notice sudden changes in vision, flashes of light, more spots, floaters than usual, or if it looks like a curtain was pulled over your eyes. So how can you prevent eye disease from developing? You should make sure you manage your diabetes ABCs. This includes A1C, blood pressure, and cholesterol. And if you don't know what any of these are, you can talk to your doctor and they'll explain how to manage these. If you smoke, you should also quit smoking. And then also, you should have a dilated eye exam at least once a year. Your eye care professional can determine how often you should be seen, and your doctor can spot early changes associated with diabetic eye disease and initiate treatment to prevent vision loss.
All right, so next we'll be talking about depression and diabetes. So how common is depression among diabetics? Diabetics are 2 to 3 times more likely to experience depression than the general population. Approximately 1 in 5 adults with type 2 diabetes has depression. And this is common because of significant lifestyle changes and increased stress that's associated with disease management. And this can affect mental health in various ways, one of which is depression. However, despite the high prevalence, only about 25 to 50% of those experiencing depression are diagnosed and treated. So why is it important to be aware of this? Depression can make it difficult to adhere to diet, exercise, and medication regimens that are prescribed for diabetic management. And untreated depression can worsen diabetes, leading to increased blood glucose levels and a higher risk for diabetic complications such as heart disease, nerve damage, and eye disease. And without treatment, depression can get worse over time, and this in turn will worsen diabetes too. So depression may not always be detected by your doctor, so it's important to monitor for symptoms on your own and then discuss it with your doctor as they come up. However, depression can vary significantly from person to person. So it's important to stay aware of yourself and monitor any changes in your mood or behavior. Common symptoms include withdrawal from friends and activities, loss of energy, change in sleep patterns, changes in appetite, difficulty concentrating or making decisions, or feeling sad, empty, hopeless, irritable, anxious, or guilty. And again, these symptoms can vary from person to person. Some people might experience them in a milder form or more severe. So it's always important to understand yourself and notice any changes in your behavior. So how can I manage depression? If you're experiencing depressive symptoms, always talk to your doctor. Treatment options can range from small lifestyle changes to therapy or medication. And it has been shown that treatment is very effective. So that's why it's important to talk to your doctor and take the necessary steps. And managing depression can improve not only your diabetes, but also your overall quality of life.
Hey everyone. So I'm going to talk to you about reducing hyperglycemic risk. And before we can talk about that, let's talk about the long-term effects and the short-term effects associated with hyperglycemia. So as many of my colleagues have talked about, hyperglycemia can actually affect every organ in your body with different severity, right? So we've talked about eye health, how it can cause cataracts, glaucoma, retinopathy, but diabetes most importantly affects your cardiovascular health. So it can cause heart disease, peripheral vascular disease, and it can cause increased risk for strokes. Hyperglycemia can also cause problems regarding your kidneys, so they can cause nephropathies that can lead to decreased kidney function and eventually chronic renal failure. They can also cause nerve damage, so hyperglycemia can cause decreased sensation in your extremities. They can cause increased numbness and other nephropathies in your extremities. Nephropathies. What are the acute effects regarding hyperglycemia? So the most worrisome one we're worried about is diabetic ketoacidosis. So this generally presents in cases of severe hyperglycemia. So you're looking at things like greater than 600 blood glucose. But you'll be surprised how fast this can come on. It can acutely present with signs like confusion, nausea, vomiting, or deep and rapid breath like Kussmaul respirations. Interestingly enough, it can actually present with fruity breath. So a lot of these patients actually present as like an alcoholic during the day. So many people will just think that they're drunk, and that could cause a delay in treatment. So it's always good to kind of keep an eye out for that. The reason why we're worried about these, the acute term effects of hyperglycemia is because it can present or it can progress to coma and eventually death. So what can actually cause hyperglycemia? So many different things can cause it. The most important one is an imbalance between the amount of carbohydrates you're actually eating or drinking and the amount of insulin that you're injecting into your body, or just the amount of insulin that your body is actually making. It could be due to just being less active. So right now, especially with COVID-19 going on, we're not going out as much, we're not walking around as much. That can definitely cause an increase in blood sugar. It can also be due to physical stress from something like flu or cold or COVID, or it can be due to emotional stress, such as familial conflicts, emotional problems. If you're going to work and having some work stresses there, that can definitely cause an increase in blood sugar. Some additional causes could be, just some changes in medications. Things like diuretics or steroids could increase your blood sugar. So it's always important to talk to your doctor before you take any new medications or anything like that. You could also experience something called the dawn phenomenon, which is, a surge of hormones that affect your body in the early mornings. So it's important to talk to your doctor to see if that's affecting you. So how can you actually reduce your risk? It's most important. The most important advice I can give you is to monitor your diet, right? So follow a well-balanced diet and make sure not to skip any meals. Most people think that, oh, I'm going to skip this meal, so I'm not going to need to take my insulin shot. I'm not eating as much glucose or whatever. But that's not how it works, right? Your body goes into this stress mode and can cause you to have increased blood sugar. So it's very important to follow your diet and not skip any meals. It's also important not to drink, it's important to drink plenty of water and limit alcohol, juices, and sugary drinks. It's very important to take your medications, whether it's pills or insulin or whatever, as prescribed by your doctor. It's important to monitor your blood sugars closely to see what specifically makes them rise or fall, right? You want to measure it the same time every single day and report that to your doctor. It's important to exercise regularly. And last but not least, it's important to see your doctor regularly and monitor for any complications. And that's actually going to end our conversation. Thank you guys so much for taking the time to listen.